The South African Depression and Anxiety Group, or SADAG, and Discovery Health are hosting a one-day workshop today in Sandton. Its guest speaker is international renowned speaker and one of the world's leading experts in this field, Professor Stefan Hoffmann from the Boston University. He'll be speaking on how cognitive behavioural therapy can be used effectively in the treatment of illnesses such as obsessive-compulsive disorder, social phobia, depression and anxiety. Joining the professor in studio as well is the chairperson of SADAG, Dr. Kulinda Linda. Good to have both of you. Thank you very, very much for being with us here on the program.
Thanks for having us.
And welcome to South Africa. Thank you for coming and sharing your views on this. A lot of people might not know what we're talking about when we say cognitive behavioural therapy. Explain what that is.
Absolutely. It's a family of therapies, of psychotherapies, that focus on maladaptive thinking patterns and behaviors that keep emotional distress alive, that maintain emotional disorders. It's a very effective form of treatment that has been shown to work for all sorts of different groups around the world. It's widely disseminated in Europe, in the US, and often is the first-line treatment for most mental disorders.
Okay. South Africa, is it commonly used here in South Africa?
Unfortunately not, because there are very few universities who are training in CBT, and we're hoping that that will change. So there are a few pockets here and there of us doing it, yes.
Yeah. Why is that? Why do we find that it's used commonly in other countries and yet here in South Africa it's not necessarily common practice?
I think it's a complex problem. Tradition is certainly part of it. Other certain orientations have established it themselves, such as psychodynamic therapies, and it's difficult to make room for new interventions and, quite honestly, also better and more empirically supported interventions.
Yeah. Is it effective?
Very much so.
A very effective form of treatment.
In fact, it is an empirically supported treatment. So only the type of interventions, counter CBT, that have been shown to be effective in randomized controlled studies, often comparing with the most effective pharmacotherapy. And consistently it has been shown that CBT is at least as effective as the most effective drug.
So at the end of the day, I would imagine that with two powerheads like Discovery and SADAG coming together and bringing the professor here and really focusing in on this, is this a way of you saying, come South Africa, let's move in this direction? This is a better way forward than perhaps using so many drugs that we are using to try and beat these illnesses.
Very much so. And you know, CBT is something which could be rolled out quite widely. You know, we could teach it, it would be quite effective. You could use it in all sorts of communities and cultures. So, you know, SADAG has always stood for advocacy, and Discovery very much a thought leader. So with all of that together, we're hoping that this will be the beginning of quite an interesting process.
Yeah. Let's sort of go to Psychology 101, because I mean, I need to understand this as well. How do you use it to treat, and I said in the introduction, obsessive-compulsive disorder, social phobia, depression, anxiety, things like that. How do you treat that?
So it is a short-term intervention, typically 12, 16, sometimes 20 sessions and weekly sessions, usually done individually. So it's a fairly short-term intervention, focusing on emotional distress and thinking patterns and behaviors that are influencing emotional distress. So there's no single strategy. There's one CBT model, but many cognitive behavioral therapies out there tailored to particular problems. Often there are, for anxiety problems, there are often exposure interventions involved. For depression, you have a lot of reflection about past experiences, to what extent they influence the present moment and the like.
Yeah, but some people just want a quick fix, or some people need a quick fix. Is there such a thing as a quick fix when you are going through these illnesses that we speak about?
No, there's no quick fix. In fact, in a way you give people tools to handle their distress, better tools than they had before. And often we see long-term gains. So after, it's sort of like training a muscle as you work out, and you have to continue with this workout for it to be effective. And similarly, CBT shows usually its benefit in the long term.
Yeah. So in the countries that this works in, I mean, you've said it's highly effective, but When do you start seeing a difference in a patient? I mean, if I am diagnosed as with depression today, how long would I have to go through this kind of therapy to start seeing a difference in my behavior?
I know it sounds too good to be true, but you will feel better within weeks.
Sure.
You should also consider the CBT is such a cost-effective intervention. It really doesn't make sense not to do it. Yeah. The costs that are accumulating due to inappropriate care, lost productivity, unemployment, suicidality are staggering, and CBT offsets these costs. It's a lot less expensive to provide adequate care using CBT than not to.
You don't use medication in conjunction with CBD? Like
sometimes you
CBT?
do. Sometimes you do. It depends on the individual. In some cases, for depression, we know that severe depression can be more effectively treated with CBT in combination with pharmacotherapy. At other times, you do not need to administer medication. It depends on the client.
Very, very interesting. Okay, so we're running out of time, but Dr. Linda, let's find out just more about this workshop. It's taking place today. Are members of the public welcome, or is it really a closed session?
It's more press, and I think that the press will be the ones who will then spread the word.
Good.
So there are a lot of people coming. We'll have Prof. Hoffman talking about CBT. We'll have other local speakers as well, psychiatrists, psychologists, all talking about an area of speciality, depression, OCD, fear of flying, and a lot of it related back to CBT. And then social phobia, we'll be covering that as well.
Okay.
Yeah, and this will all be in the press over the next few days.
Excellent. Thank you for joining us. Thank you very much for your time as well.
Thank
Good
you
luck going forward. This talking here on the program about CBT and going forward with the SADAG chairperson, Dr. Kalinda Linda, and not Professor Richard Hawker. We didn't have him in studio. We have Professor Stefan Hoffman from the Boston University, who's going to be talking about cognitive behavioural therapy. Also remember, on the screen, that's SADAG's number. If you need them at any time, you phone them, visit that website, and they can help you. Let's take a break. When we return, Ayanda will bring you the news at 7.